Going to give it a few minutes. Thank you for joining on time, and we'll just give just a couple of minutes for people to join before we launch in. If you are on, this is the ACLC's committee report webinar. We will be reporting on the committee that took place earlier this year, the Committee on High Value Partnerships. So hopefully you're on the right webinar. We're glad you're with us. So give us just another minute. Did not mean to advance that. Okay. I think we will start in just a minute. Okay, 12:03, let's get started. For everyone who is on, welcome this afternoon, wherever you are, to the ACLC committee report webinar. As many of you already know, I'm Tom Merrill, and up until just recently was the committee director for the ACLC, and I oversee a lot of the research. And it's just really good to be with you. This was not a committee that I had the privilege of running, but I did hear great things about this committee. And so I'm excited to host this webinar, to be able to have our guest today share with you a synopsis from this committee and preview the resources that are coming out. So let us jump in. If there are any that are on the line who are not familiar with the ACLC and you are joining us for the first time, let me give you a brief introduction to the ACLC. It is a collaborative organization that brings together stakeholders of all sorts to discuss the transformation to value. Most of our members are providers, and so that is our focus, but we recognize that there are lots of other folks involved in this system that are working to facilitate that transition. So if you had to summarize the three things that we do into just, or the things that we do into just 3 points, it would be helping providers know what to do, when they should do it, and how they can implement it. So this particular webinar will be an example of that third one, how you can do it. But a lot of our work stems back to our foundational resource that we released a few years ago called the Accountable Care Atlas. And essentially what this does is it lays out what providers ought to do and when they can do it. You can see this has a timeline. You can also see that it's not readable. There's so much on this. This resource exists on our website. It's free. You can go, and it breaks it down into much more intelligible portions, but this visual is always a favorite of all of ours because it just shows you in one take the enormity of the work that's being asked of our provider leaders. So let's move on, and just let me give you an overview of how the ACLC's committees work. We have pre-session interviews with all the committee members to help form the agenda for the committee meetings that will take place over a 3-month term. For this, all meetings were virtual because we're in a pandemic. Usually either the first meeting or the third meeting is in person, and it's a very rich experience. We made that happen virtually this time around, and it really turned out well and kept everyone safe. So in any case, where we are in this process map, we have finished all these steps. We are now, the committee has disbanded, and we are now giving you the report. By the way, all the meetings for this committee are hosted online according to under the committee webpage. So you can go and listen to all these. If any of these asks just really pique your interest, you can dive deeper, but here you're just getting the synopsis. Okay, so without any further ado, as mentioned before, this committee is the Committee on High Value Partnerships, and we'll talk in just a minute about what that means. This committee met in March and convened in and wrapped up in June. Here is a look at some of the committee members. A lot of these names that you're very familiar with. These are thought leaders in their regions and at their organizations. Their organizations themselves are very well known and have impressive track records in accountable care and value-based care. And we have the pleasure of having one of these folks with us today, Mark Cronin from Accountable Health Partners. Just a real highlight in the industry, and we're excited to hear from him. Our sponsor before we jump in for this committee was 3M, an organization that we're all very familiar with and has a very robust set of offerings in this space. And we'll get to hear a little bit more about that later on, but we wanted to take a moment and thank them for their generous sponsorship of this committee that just turned out really well. And we'll look forward to hearing from them later. Without diving in, I wanted to give you a snapshot of the competency framework that was developed over the months in this committee, which you can think of as a synopsis of the topics that were covered. And so if you're a healthcare leader and you're trying to break down what it means to look for and develop high value partnerships, here's your snapshot. What I'm showing you here is a screenshot of the 2 resources that will come out from these committees, and these will be published. They'll be on the website. The first is what we call a competency orientation guide, and that is a 2-page document that goes into more detail, but is structured to mirror that committee framework that I showed you on the last page. But it really does a great job of distilling all the powerful conversations that took place over the 4 months or so that this committee convened, and that will be made available shortly. The other that you see on the right hand is what we call a case study brief, and that is an actual case study of what finding a high value partner looks like. So for this particular case study, one of the organizations on the committee, the Physician Organization of Michigan, they volunteered to be our case study subject. That document is also 2 pages, so very accessible documents, powerful resources, and those will be tweeted, emailed, made available very soon if they're not already available on the website. So please go to those resources if you want to go deeper. All right, so getting to the meat of today's webinar, we have Mark Cronin, who is the COO of Accountable Health Partners. And I want to have Mark introduce himself, and then I have a series of questions for Mark to help him walk us through what he learned from the committees and what the committee was able to learn from each other. So Mark, how's your audio?
If you can hear me, my audio must be pretty good. Does it sound good?
Yeah.
Great. Okay. So thanks, Tom. I appreciate that. As Tom said, my name is Mark Cronin. I'm the Chief Operating Officer of Accountable Health Partners, or AHP. AHP is the accountable care organization that was created by and is affiliated by the University of Rochester Medical Center here in Rochester, New York. We've been around for 7 years. We've got about 2,100 physicians and 8 hospitals in our network, and about 365,000 lives under contract. So I've been involved with the ACLC for a couple of years now, and I think there's a great organization. Could get people together from all over the country and learn from each other and advance the cause. So glad to be with you all this afternoon, and know that my comments are really on behalf of that previous list of really good committee members that we had.
Awesome. Thank you, Mark. Mark is definitely a veteran, and we're lucky to have him involved. So Mark, first question for you is actually about what this competency actually looks like at your organization. Some of these resources, maybe they break it down conceptually, but we'd love to hear how your organization uses high-value partnerships to further value-based care.
Sure. And I guess the way I'd answer that, Tom, is, kind of foundationally, I look at, so much of our work in accountable care is developing a high quality network of providers and expanding it. So, with that as a foundation, for us, as an ACO who's attached to a large healthcare system, it looks like we are looking for what are other ACOs or large multi-specialty groups, that we choose to partner with. So we're on the lookout for that, just as part of a national or a natural course of business. If you look at what are we here to do, our goal is to improve the health of a population and to make healthcare more affordable. So with those pillars, as we like to call them, we are always looking at what are the partners, who are the partners that will help us do that? Who's going to help us make the population healthier and make healthcare more affordable? So we use partnerships either within the greater Rochester area here or in contiguous geography who will help us expand our reach.
Awesome, Mark. Thank you for that. And your question, because I have follow-up questions, but I'm going to hold them, is reminding me that if you have questions as our audience, hold them. We have some time toward the end reserved for that. So awesome. Let me jump into my next question, Mark, which is you have a lot of experience in this world, in the world of accountable care and value-based care. But as you mentioned, the committee had a lot of other really impressive folks. What are some lessons that came to you from the committee discussion?
The committee had great discussions, and this is a complicated domain, and we had a lot of war stories to share of, from the conceptual, what does it look like in a desirable partner for your ACO versus, what does it actually look like as you pursue these? So I guess as I say that, Tom, I would start with, the concept that, many would say, and I think that we as a committee started with, okay, well, in exploring potential partners, and your slide with the competencies show this, you should look at attributes like strategic direction and cultural alignment and, what's the infrastructure, what's the financial outlook. And those are all true, but to some extent, they're also sort of obvious and sort of motherhood and apple pie. So intuitively, we know that there are important criteria, but we also know you're unlikely to find a prospective partner who's a perfect fit in all of those domains that we would agree are important. So, from our experience and from the committee's discussion, there were a few key items that I'd highlight for folks this afternoon. One of them that's particularly important is to figure out what is your prospective partner's motivations in seeking a partnership. What are their motivations? Why are they doing this? Be transparent about it and be willing to walk away if not aligned. So one example, people on the committee reported scenarios of, once we got into it, we learned they were looking for something entirely different. I remember one committee member talking about, we got pretty far along in conversations and discussions, and we concluded that our prospective partner wasn't in it for the same reasons as us. They were actually looking to, take on and compete with the local health insurer, and that wasn't at all what we were trying to do. So what are the motivations is important. Another lesson learned, different levels of capability are okay. And it's good if they're complementary. So for example, you might say, well, gee, if we're really far along in care management, the prospective partner is not, that's a bad match. And we concluded that's not necessarily a bad match. If they're not far along, but they're really eager to learn and coordinate, that may actually be a very good match. Same thing with different track records of success. Just because someone maybe has stumbled coming out of the gate and you've done well doesn't mean they're a bad prospective partner. And again, I use the phrase motherhood and apple pie, so I'll say something that qualifies under that. Trust among the key players is essential. People, when we traded war stories, people on the committee reported scenarios of key folks not trusting each other. One of the committee members reported, feeling that a high-level leader and their prospective partner, felt like a used car salesman when you talked to them. They said, in retrospect, that should have been a red flag, and we might have stopped things earlier. So very important to, if there's not trust, like so much in life, then that should be a red flag. So I guess I'd conclude my answer to this, Tom, by saying, we talked about in the committee, it's really hard to make well-informed decisions about partnership attributes of another. It's kind of like our personal relationships, our spouses. It takes a while to really get to know someone, warts and all, and before settling, on a partnership that's going to work. And so therefore, I think another key principle is before you, dive right into a partnership that's incredibly complex and that you can't get out of, continue to work together for a while and take baby steps so ultimately you can get out of it if 6 to 9 months from now you figure out, hey, these folks have totally different intentions than we did.
Yeah, no, I like that analogy, a long courtship. That makes a lot of sense.
Yes, it's worked well for a lot of us, including me.
Yeah. All right, well, last question for you, Mark. What are some of the partnership strategies that you're looking at going forward?
Yeah, I'd answer that question fairly generally, Tom. I look at it as accountable care has certainly come a long way in the 7 years since AHP was formed, and certainly, longer than that as other fine organizations that predated us. So even though it's changed and it's morphed and it looks a lot different, we are absolutely convinced payers are going to continue to be very highly interested in higher value care. That is not going to change. Absolutely not going to go away. And so therefore, we are going to continue to seek partners, as I said, here in our area, contiguous geographies, who we think we can work with in pursuit of that, trying to make healthcare more affordable, managing the health of the population. So payers are going to remain interested, so we're going to keep looking for these partnerships.
Yeah. Oh, I love that. Is value-based care here to stay? Well, ask the payers. They have no intention of continuing to pay more. Okay.
They'd be shocked if you answered no.
Yeah. Yeah. Not a good situation. Okay. Well, thank you, Mark. We're going to keep Mark with us for the Q&A, but thank you for this dedicated time, Mark.
My pleasure.
And we will move into our sponsor message. So let me briefly introduce Thilo, who coming to us from 3M, and I will have some questions for Thilo as well, but I'll let him introduce himself first.
Thank you, Tom. So my name is Thilo Köpfer. I'm the VP for markets with 3M Health Information Systems, and I'm actually a physician by training. And people might wonder, why do we have the international guy here at the ACLC? But as much as this is a US topic, it's at the same time also a global topic. And so I personally was very interested and continue to be very interested in the work that is done here in the US on accountable care and value-based care, as we really see similar topics and challenges in all the other countries where we do business. We're doing business in 20 plus countries, a lot in Europe, and there are exactly a lot of similar challenges. And so I'm looking forward to leverage some of the learnings from this partnership. My business outside of the US.
Great. Well, thank you, Thilo. I know the committee was thankful to have you. So the questions that I have for Thilo actually center around two things. One is why would 3M be interested in sponsoring this? And I think you've really kind of spoken to that already, Thilo, but would love for you to elaborate on what 3M does, and then also things that stood out to you from the committee that you learned.
Yeah. So I think this specific committee is really very near and dear to 3M in general. 3M it's pretty much in our DNA, and 3M is a business that is built on partnerships. We're trying to build long-term partnerships with our clients as 3M Health Information System in the provider space, in the payer space. But also as the bigger 3M, obviously, we're really striving on building our business with partnerships in the industry. And obviously the recent COVID pandemic and so on, we've been quite in the news as 3M, the big 3M Corporation. And so there are a lot of things that is in our DNA in the business that we think to be successful in any environment, you can't do that without partnership. So that was one of the main reasons to sponsor this committee specifically.
That's great. Thilo, any thoughts on lessons that stood out to you from the committee?
Yeah, well, I think Mark already kind of summarized it perfect. So when we at 3M have relations with partners in the industry or looking for partnerships, there are these three topics like having shared values, which is kind of the cultural element, having common objectives, common goals, and trust. I think trust is another big one. I think it was nice to see with the committee going a little more into details in that regard and looking at capabilities. Are capabilities, do they need to match or not? And so the things that Mark mentioned were kind of my key learnings here as well.
Okay, well, great. Well, thank you, Thilo. Let us move at this stage into the Q&A. I'm going to check in with Bree and Sergio to see if we have any questions in the queue, and if not, I have a couple of my own.
No questions yet.
No questions yet. Okay, so my first question is for Thilo, actually, and that is, well, it's for both of you, actually. Maybe we'll ask Thilo to respond first, and then Mark, and that is the aspect of data. How much did that come up in the committee discussions in terms of, trying to understand the performance of a prospective partner, maybe even before you engage them? Or is that, did that factor into the discussion?
I think it came up. Yes, certainly was discussed, but we and Mark will correct me, but we didn't go into too much detail on the data. I think there was a common understanding that data availability is still a challenge. Not ability, it's just there's a lot of data available all the time, but making and having the right data available to make the informed decisions still seems to be a challenge in a lot of areas.
Yeah, boy, truer words were never spoken. The very end of your comments there, Thilo, it continues the availability and even with the availability of the data, how best to utilize it in order to meet those challenges of managing the health of the population, making healthcare more affordable. It seems to be a challenge to a greater or lesser extent around the country. But yeah, this topic certainly came up and really interwove itself through our topics in each of our sessions for the committee. And I think it in my mind, it really kind of comes up in a couple domains. One is in order to once just in the course of everyday business, and once a partnership is consummated, utilizing the data is got to be part of the day-to-day blocking and tackling of your work. But I think as it relates to exploring partnerships, it's essential to know what you're getting into before you decide to proceed with something. So some kind of data sharing, recognizing confidentiality issues and sensitivity, so you understand. All right, so you say that you've been effective at managing cost, for example. Can you show us what that looks like? Can you give us some sense of the membership that you've got attributed to us? What the risk profile is. So it's a really important topic, certainly, Tom.
Okay, so if I were to synthesize your comments, yes, data, use it where possible, but sometimes it's not available, and you just have to move forward. That's just kind of how a lot of this stuff goes. Okay, so another question I have for you, Mark, I'll direct this one toward you. You made a really interesting comment about how it may not seem obvious, but a partner that may be, for example, in the care management aspect, which is huge in population health, maybe they're way behind, that doesn't necessarily preclude them as a partner. Can you maybe just speak more to that?
Sure, because I think here, what perhaps in exploring a partnership is more important is the intentions and interests and philosophy. I guess you could say that generally, but you could also say that about particular areas, such as the care management example, Tom, that you cite. So if I continue to use that as an example, if I were to if we felt that our care management operations were strong and we had a good staff and a strategy, and we were exploring a partnership with someone who wasn't particularly well developed, if their feedback to us was, well, we think it's really important, we just developmentally haven't gotten that far, or we had a strategy and a director who didn't work out, or something like that, then that wouldn't necessarily concern me as much as if they were to say, care management? Do you think that's going to be important in accountable care? We're not convinced. Mm-hmm. That would be a lot more concerning to me than an admission of, yeah, we need help here. And I know even from our experience here at HP is, we've looked at folks we've partnered with. Frankly, I like looking at someone who's some of the core blocking and tackling of accountable care, such as care management, such as data, to your previous question, Tom, who are doing things different than we are, because it's an opportunity to learn for us to get better.
Yeah. Great. Thank you, Mark.
Sure.
Okay. Let me check in with Bree and Sergio. Any questions in the queue?
No questions.
Okay. I think we've covered everything, Mark and Thilo. There is nothing more to be learned, and you guys have answered all the questions preemptively. Okay. Well, I think we never want to have a webinar go longer than it needs to be. We don't mind it when it's punchy and concise. So I think at this stage, what we're going to do is briefly talk about the next podcast that's coming out. If the members that are on with us right now know that this is a new initiative that we're doing, and I think it might be Sergio. Sergio, what are the details that we should just briefly mention here about the next podcast coming out? Putting you on the spot.
Yeah, we have launched a new podcast, Race to Value, and this is hosted by our director Eric Weaver, along with Daniel Chipping, and each week we interview different leaders in the healthcare arena, and specifically in the value space, and hearing their experiences and their stories, and it's been really exciting. We have about on our website we have 4 episodes listed, and we have one coming out each week. So please come and subscribe. You can access the podcast on all of the traditional platforms where you get podcasts. It's just or you could even listen online at racetovalue.org.
Okay, awesome. Thank you, Sergio. Yeah, just one more way to access great conversations with leaders like Mark Cronin and Thilo from 3M. And anyway, so we'll direct you to that. And I think with that, we will say thank you again to Mark Cronin for being our guest, and for Thilo Kupfer from 3M. Really glad you guys joined us today.
My pleasure, Tom.
Thank you.
All right, and then we'll say goodbye to the rest of you, and see you at the next webinar, the next podcast. But thank you all, and continue on your journey as we support you. Thanks for being with us. Bye, everyone.